90.3 FM. And like I said, it's time to talk health issues. Yes, health related issues. And don't forget, I do these every Thursday with a doctor, Dr. Charles Adeogun. Yes, he's in the studio right now. And from now up until 1200 DOT, we're going to be talking health. All right? Is that good? Beautiful. Thank you so much. Now let's take a walk quickly. Dr. Adeogun, a very beautiful morning to you.
Good morning to you too. How are
Good
you doing
good
today?
morning. I'm fine. Doing great. Good to have you join us again.
Thank you.
All right, everyone, like I said, feel free to join the conversation, okay? Just get very close to your radio set. Aside politics, we need to look at our health. It's very, very important, okay? That's why I urge you to make sure you listen to this information this morning. Now, this morning, I want us to look at something really, really, different. Self-medication in Nigeria. Self medication. Everyone is a doctor in Nigeria. Everyone is a nurse. Everyone knows what to do when this is happening. Everyone knows what to do when that is happening. Everyone will always want to advise, even a neighbor. My daughter took so and so. You can also do same. Your son or your daughter can also take so and so pill or go for so and so whatever. It's a normal thing now. Is it not that normal thing that don't worry yourself now? I have some pinch of whatever at home. Let me come and give it to you. Self medication in Nigeria, and of course these one drug fits all. One drug can take care of so many things, like MC Chooks will say. You can find such people inside the molue, advertising. They'll tell you, well, if you go to a pharmacy, the drug is 14,500. All right, but inside that box, inside that molue, is 255 naira. And so we want to look at this issue with self-medication. Why we should discountenance self-medication. It is even a good thing. What should you know, or what do you have to know about self-medication? That's what doctor will be talking to us about this morning.
So, self-medication is a practice amongst Nigerians and among, within our society generally, where people try to treat themselves of illnesses that they are not even sure of the diagnosis in the first instance. Because if you have symptoms are those things that a person experiences when they feel unwell. It can be a fever, it can be headache, it can be body pains, it can be diarrhea, it can be vomiting. Those are symptoms, but symptoms are still not the diagnosis. Something is responsible for causing those symptoms, and I think the practice of self-medication being rampant also comes from the idea of Nigerians generally trivializing the medical training, because people went to study medicine, and get certified to become doctors. It takes a whole lot of study, a whole lot of research, and going through a rigorous training to become a licensed professional, a licensed health professional. So you cannot underestimate that. And the main training is to allow you be able to evaluate a patient, get a precise diagnosis, and then institute the right treatment for that patient. So a number of people who think on their own they can manage situations would only be shooting themselves in the foot, because at the end of the day, if you are just assuming that a person has a particular condition where you are not certain that that is what the person is dealing with, you may end up getting the case more complicated, and eventually when you now notice that things are out of place or out of hand, you now rush back to the hospital you didn't want to go to at the beginning, thereby wasting a lot of money, wasting in crucial time that you'd have used to save the person's life,
Okay.
and also risking unnecessary complications that can arise. And I think it also stems from the idea of economic implications of going to the hospital. A lot of people believe that healthcare is expensive, but the truth is nothing is actually cheap. apart from healthcare, housing is not cheap, education is not cheap. So, but that is how life is. A lot of professional services that you need are not cheap. Legal services, for instance, are not cheap too. So I don't know why people would now choose to take a very, very deadly risk, regarding their health, managing situations by themselves, or allowing themselves to be managed by people who are not licensed professionals. And at the end of the day, they only have themselves to blame. We have a lot of people who, because they are hypertensive, they should have been on the right medications to control their blood pressure, going for regular health checks and monitoring, but they refuse to do so. And at the end of the day, you find out that most of them end up coming down with a stroke, coming down with kidney problems, coming down with sudden cardiac arrest, and all that. You hear people slumping and dying everywhere. These are from reasons like this, because they don't go for wellness checks. They avoid the hospital at all costs. And when there's a problem, they would rather, go for some kind of shortcut treatment somewhere, from people who are not licensed to do so. So we'd encourage everybody that your health is your responsibility, and you have to take responsibility for that. And you make sure that every step you take, every decision you make regarding your health, a proper licensed medical practitioner is involved in your care. Otherwise, you will run into a lot of troubles that you wouldn't expect. And at the end of the day, you end up spending more than you actually bargained for. So it's something that we should really, really emphasize. And for me, it's particularly painful for children, because children are dependent on their parents or dependent on the adults around them. Even if adults choose to do whatever they want to do to themselves, but don't do that to a child. Don't self-medicate for a child. Don't give a child a medication that you bought on a bus or you bought at the roadside. If you as an adult, you think, well, it's your life and you can choose to live anyhow, which we do not advise, but don't do that to a child who is still, coming up, who is dependent on you, who is dependent on your decisions. Because if you make unhealthy decisions for a child, then you're practically destroying that child. So it's very essential that we take our wellness into our hands, and then we seek the right kind of professional help when we need it.
People will tell you that they've been self-medicating. Some won't even want to hear self-medicating, that you are doing it yourself. They feel, and Shebi is what our mommy used to give us. When you have stomach ache or stomach pain, just get what's the name of this drug now? Flagyl and tetracycline. That's it. Then you're good to go.
But they forget that.
And it's been working for several years.
But you also forget that tetracycline and Flagyl are antibiotics. They are not just regular medications that you can just take. Antibiotics are, misused. There's indiscriminate use of antibiotics in this country. A lot of people will have one condition without being tested, without going for any investigation, without seeing any doctor. They just swallow all sorts of antibiotics. You hear things like, I want to flush my system. You hear something like, I normally flush my system every 3 months. So I think it's time for me to flush my system, and they go and buy antibiotics. And it's so shocking that some people don't even buy one antibiotic, they buy a combination of antibiotics. And they are not thinking of drug resistance. They're not thinking of clearing out the normal flora of beneficial bacteria they have in their systems. And they're not thinking of what can happen to organs like the kidney and the liver. They are unconcerned about all that. And they get these medications, use it, whether it is needed or not. It is not their concern, and they would even give their children. So please, we need to have a reorientation.
What's up with this flushing of the system you spoke about?
It's something we just hear from people. They would say, I just need to flush. Can you give me a drip? I just need somebody to give me a drip and let me flush my system. I'm like, what are you flushing? Are you a toilet? I don't understand. I don't know what you are flushing. What are you flushing out of your system? For you to know that you need any antibiotic or you have an infection, it is a diagnosis a doctor must make. And the doctor doesn't just look at you and label you with a diagnosis. He takes a detailed clinical history. He does a physical examination on you, and then he will send you for relevant investigations. And that will allow him make a proper diagnosis. Then he can confidently say, yes, you have an infection, and he can confidently say, yes, this is the kind of treatment you require. So it is not a patient by himself or herself that would say, I think it's time for me to flush my system. And we don't always need IV fluids. A lot of Nigerians would always say, please, you just give me drip. It's drip I need. Just give me drip. And you're wondering, where is that coming from? You only give IVs in certain situations. And you don't even know that even that IV access, that cannula that you have in your IV, it can even be a potential source of infection when you don't need it and when it's not properly managed, particularly when it is not done in a hospital setting. So a lot of people just risk their lives in different ways. And when you ask them, what do you need this drip for? So that's how I do it. Every 2 months, every 3 months, I just ask them to give me drip.
Just flush my system.
I just flush my system. I feel better. And I ask myself, why would you need an IV? We give IVs to people who may not be able to tolerate orally, or who for some reason are vomiting and cannot keep anything down, and they need to be rehydrated. So you need to find another route of administration of fluids for them to prevent dehydration, or people that need IV medications. You need the medications to be given intravenously, and it is only for a limited period of time. But for you to now be a perpetual drip taker, I am trying to understand where that is coming from. So we need to create awareness, and we need to let people understand that some of these procedures have their own downsides, and you should always make sure that when you need to do anything IV, let it be coming from a doctor. Let it be the doctor requesting for that. Let it be the doctor prescribing that. And it must be done in a proper hospital setting where you have sterile conditions, where you have a clean environment, and you are not, exposing yourself to undue infections that normally you should not get. Because at the end of the day, people always complicate issues. And for me, I think it's very painful when I hear patients that have been managed at home or managed somewhere by someone who is not a licensed practitioner, and at the end of the day, valuable time has gone. You hear that the person has been treated for close to a week and not getting better, and then the hospital you were running away from, when the person is now gasping and cannot breathe well, you eventually bring the person to that hospital. I don't think it adds up. I don't think it's reasonable to do that, because at the end of the day, you are now bringing somebody who would have been saved at the last moments when the case has already been destroyed, or the case has already been, made horrible, and you're now expecting the doctor to do magic in the hospital. That doesn't work. We need to be properly oriented and make the right, healthy decisions that will make sure that our quality of life as a people improves and our life expectancy. People don't need to be dying every day like we're saying it, because that's the truth. It's happening. It's just that we may not hear how much of it is happening, but people are really dying in their numbers from very preventable causes. And I think we should hammer this, well to our audience so that they really understand the importance of this.
But what if someone follows up with what the doctor used in treating you previously?
Treating another person?
Like, okay, I bought this drug. Last time I was ill of da, and the doctors asked me to get this. I got it. Can I still do same? Instead of going to meet the doctor again,
the second time,
I just decide to. He said I should use this before,
and it worked,
and tell me, let me use it again now.
Okay.
How about that?
Very smart way to think, but it doesn't always work. Because the truth of the matter is that sometimes there are many conditions that mimic each other. They have similar symptoms. So you cannot say because this is what you had in January, that is exactly what you have in October. It may not be. It may not be. Sometimes people come to the hospital, they have similar situations of headache, joint pains, feeling weak, they are just feeling unwell generally, and they say, oh, the last time I felt this thing, it was malaria, and they said I had infection. So you just go and buy anti-malaria and buy the same antibiotic you used in January, but this is October. You've forgotten that this is a completely different situation. But if you go to a hospital and the doctor examines you and runs the right test, he finds out that you don't have malaria, he finds out that you don't have an infection, though you have those symptoms, and he just asks you a simple question: how have you been sleeping? When last did you go for a vacation? It's the end of the year. Have you had any vacation this year? And your answer is no. Have you been sleeping well? And your answer is no. Have you had time to rest? Your answer is no. Then you have your answer. Your answer is just get yourself some rest and you'll be fine. And the doctor just writes to you a sick note or something, telling them at work to allow you, some time to rest for you to recuperate and all that. You may not necessarily be even on any medication. And we found that a lot of people recover just from getting the needed rest, and their sleep problem, is corrected. They feel better without any treatment. So you would have been wrong if you had taken the medications you thought was responsible will work for you because it worked in January. So every case is peculiar. And you cannot say because your brother has a problem and has used certain medications that the same medication will definitely work for you too. That's a wrong assumption, because you are a completely different individual and you may have allergies to some of the constituents of that medication. So you are giving yourself a medication that a doctor has not given you. You don't know the potential effects it can have on you. You are forgetting the underlying condition that you have that your brother does not have. You know, you may be asthmatic and your brother is not asthmatic. You may have peptic ulcer that your brother does not have, and that drug was perfect for him. But you would just assume it's my brother, he used it, it worked for him. Let me just take one of his meds and use it. It's always dangerous. So we keep telling people, it's not just that we want to be seeing your face in the hospital or we want to collect your money all of the time. It's for your own safety, because you may run into problems. Every drug is a potential poison if it is not taken in the right context. In the right context meaning for the right reason, in the right dose, and at the right time, and for the right duration of time. So if you are not doing all that, you will run into problems. And you will say, but it worked for my brother. Yes, but it's not working for you. Now you use this, you are covered with a rash from head to toe. You don't know where the rash is coming from. You are itching all over, you are throwing up, you are nauseous, but it didn't happen to your brother that way. So that means that for every individual, your health is priority and your health is unique to you. Anything you're experiencing, go to see a licensed professional to evaluate you as an individual and tailor your treatment or management to what suits you as a person, as an individual. That's the only way.
I just want people to get to understand what we're discussing today. I don't know if you've heard someone say, for instance, paracetamol, that normally they tell you just take two tablets of it, right? Have you heard people say 2 doesn't work for me, I take 3 or I take 4? I've heard people say that.
Yeah.
Why?
Correct. Yeah, because over time
they say 4, 2 doesn't work for me, I have to take 4.
And they forget
3.
that each tablet of paracetamol is 500 milligram. One tablet is 500 milligram. So when the pharmaceuticals that produce the drug and the doctors that prescribe the drug, they give you the right dose that is safe for you to use, and you, the consumer, yourself, choose to go beyond what was recommended, are you trying to say you know better than the people that made the drugs? Are you trying to say that you know better than the doctors that are prescribing the drugs? Are you trying to say you know better than the people that know the adverse effects of this drug and the potential effects it can have beyond a certain dose? Do you know a lot of Nigerians do not read the leaflets in a medication package? When you buy a medication, it comes with leaflets in it. And those leaflets will tell you, this is the name of the drug, this is the brand name, it was produced by this company, and it will tell you this is the recommended dose for children, this is the recommended dose for adults, you take it twice a day, this is the length of time that you use it for. It is a guide. So when they say you should use 2 and you are saying it's 4 that works for you, are you not looking for problems? And you will notice each of them would have adverse effects, potential adverse effects. They will tell you short-term effects. They will tell you long-term effects. They will tell you what it can do on the organs. They will tell you if you have underlying issues like kidney problem, liver problem. They will tell you it should be used under the supervision of a doctor. You will see it there written in capitals. Under the supervision of a doctor, even under the right doses. Then you by yourself, you are multiplying the dose, taking it by yourself. Are you not knocking the door for a big hazard on your health? People should pity their organs, especially painkiller medications. Your organs get big blows from this, the liver and the kidney. And we've talked about it before. Rise in kidney problems. It's everywhere, across different age brackets. It's happening every time. It's happening all the time. And a lot of people are asking, why is this happening? Why is this happening? This is one of the reasons. Taking herbal mixtures that you don't even know the constituents or the components is another.
I wanted to also mention, herbal mixtures.
Yeah.
Agbo, go for agbo. When you have,
you don't know.
People just decide to do agbo in everything. If you feel this one, agbo, there's a special agbo made for it.
And then there's one agbo that is for arthritis. If you have cataract, it will remove it. If you're having ulcer, it will heal you. If you have fibroids, it will melt it. If you're infertile, you're looking for a baby, you'll get pregnant. If you have low sperm count, that same agbo will help you. And if you have asthma, that agbo will take it out. Only one agbo. So what are those components in that thing?
No, don't say only one agbo. There are different components, are different, what's it called now? Of course. And so people say, some people ask you, doctor, are you trying to play down agbo, the use of agbo? That's what we've been using from time immemorial. We've been using agbo. So
if you are using agbo, well, the truth of the matter is that we are talking science here. We're not saying agbos don't work. We're not saying that before the white man came, before medicine became modern medicine as we know it, that people were not using natural medicine. We're not saying natural medicine does not exist. That's not what we're disputing. We're saying you need to know what you are taking.
Okay.
And there must be scientific backing for it. So if somebody finds a cure for a certain thing, it's an agbo, please let us know. Sit down with the right bodies. Show your research. Show the number of people you've treated. Show the target population that you use or your study population. All those trials. Because our medications too, before we bring them out for general use, it goes through clinical trials. It goes through years of study. It goes through years of research. We look at the safety and the toxicity of the drug. We look at the efficacy of the drug. We look at how many people have used it and benefited from it. And we study those group of people for a length of time to make sure that they don't develop any complications or problems from the use of those medications. And when it is considered safe and effective at the same time, then we can say it's safe for everybody to use. And it's a process. You cannot jump any of the stages. It's a long process that takes years before you can now say, okay, this thing is safe for general use or safe for public use.
You hear people say, agbo, some people rather will say agbo no get dosage. However you use it, it's just fine. That is natural, so it can't hurt you.
Really? But when you even eat ordinary vegetables in excess, you eat vegetable, a whole bowl of it in the morning, you eat a whole bowl of it in the afternoon, a whole bowl of it in the evening, and you eat it consistently like that, is that not excessive? Won't you start purging? Won't you start having diarrhea? Because if you're taking fiber, something that is likely going to make you have frequent bowel motions, that is exactly what you're going to get. So because it's natural, why is it causing you diarrhea? If you take anything in excess, you're going to get the effect of whatever it is. Even every good thing in excess is bad. So you cannot say something does not have dosage. Anybody that says something that you consume into your body does not have dosage, either does not know what it's saying or wants to kill you. It's one of the two. It can't be any other thing. So we need to really be able to discern what is right advice or right information from what are just fables. Because the truth of the matter is that it's your life, and the decisions you make determines your quality of life. And I like telling people that, look, whatever you take, they didn't force it down your throat, and you bought it with your money. Nobody put a gun to your head to buy any product. So for you to open your wallet and say you decide to buy something, please make sure you know what you're buying and know what exactly it's going to do to you.
Okay.
Because that's the only way you can get, value for your money and making sure you're not buying what will kill you eventually. So we need to emphasize this to people.
Okay. I'm getting several responses now, messages from listeners, some friends, alongside, and a couple of questions, but then I would want to ask this. That came to my mind while you were talking about. Can I recall that now? I would have stopped. I didn't want to stop you actually, but okay, maybe I'll recall that. Someone is saying something. He said most of the times when you go to the hospital, the first thing some doctors will ask you is, when last did you treat malaria? And they will send you to test, and they will write malaria drugs for you and all of that. That is why some people self-medicate. That's what this person is saying, Florence.
Yeah, but you know that malaria is not the only issues we have in Nigeria today. In as much as we live in the tropics, it's a malaria endemic region where malaria is something that we see at a high rate. But not every fever is from malaria, and not every issue or medical complaint anybody has is malaria. So I believe what should be done properly, the proper training, is that a doctor should listen to your complaints, take notes of your complaints, take a detailed history, examine you physically, and send you for investigations that match your symptoms. Because when a doctor is listening to you, he already has an idea of the likely things that can cause the concerns you have. So he's going to now ask you to run investigations to actually confirm his suspicion of whatever complaints you have, so that he can nail the diagnosis and now institute the right treatment for you. So a doctor always assuming that you have malaria is not proper. in as much as malaria, we have a high prevalence of it, but it is not everybody that presents at the hospital that comes with malaria. Many times people come to test and malaria is negative and they are unwell. It could be an infection. It could be a respiratory tract infection. It could be a urinary tract infection. It could be a digestive infection. It could even be a central nervous infection. It could be anything. So clinical history taking is key. Physical examination is key. Relevant laboratory investigations is key. And we also have imaging investigations. We send people for ultrasound, we send people for x-rays, we send people for CT scans or even MRIs, just to make sure that you are hitting the right diagnosis. That is the only way you can get your treatment right. Because if your diagnosis is wrong, your treatment can never be right. And a lot of people are losing confidence in the health system for different reasons. Part of this may be there, not taking a detailed history, not doing a proper examination, not asking for the relevant investigations. Because sometimes you hear people coming from other places, when you see them, they tell you, oh, I never knew this test was relevant. Nobody ever asked me to do this test. I never knew this test was important for me to check. And that may be where the answer lies. So we need to always make sure, even our clinicians must make sure that we are always on top of our game when it comes to taking a detailed history and nailing our diagnosis, because that is the basis for the treatment.
Angel from Akumonjo, let me take your question. Should I call it a question? But I want to ask a question, after reading this. He said, please, some doctors will prescribe drugs, for instance, drips, to someone to go home and look for who will help them set it up for him or her, which I have seen. Is that self-medication? I'm adding to it. Is that self-medication?
Well,
what would you say as regards this?
Well, for me, if a doctor recommends that you should take this medication and it is IV, it is safer for you to administer it in the hospital. As a doctor
there, right?
Yeah, you need a doctor to be present, because unfortunately, sometimes the constitution of some of these medications, especially the ones you give IV, you see some fluids that you have to mix up some things before you push into the veins. If you give it to somebody who is, I don't know who the person is, and you ask the person to mix, the person gets confused. The person, and Nigerians, they don't read. The person, I doubt if anybody that you would invite to your house to mix up something like that for you will go through the leaflets, knowing that he's not a doctor, or he or she is not a doctor, knowing that he or she is not a nurse or whatever, would go through the leaflet and say, let me even see, how do we constitute this thing? He would just see some liquids there and just assume, oh, you just mix this one and mix this one, and and they may just mix the wrong things. And some of these things, if you do not mix them in the right way, you're not going to get the active form of the drug, and you're not going to get the right effects. And that's the truth. And then unfortunately, people don't also understand that we have what we call intramuscular injection, we have intravenous route of administration. So the ones that
wait, you tell us that, but everyone, before you tell us that, doctor, feel free to, like I said, you can start sending in your questions right now. Okay, feel very free to send in your question. You send it via YouTube. You can watch us on YouTube right now. That is VOP 90.3 FM. Just go to YouTube, VOP 90.3 FM, or WhatsApp is 081 717 56338. You can drop your question just right now. Okay, 081 717 56338. Yeah, you're talking about muscular and what again?
Yeah, intramuscular and intravenous route of administration, because there are different ways of giving drugs. You have the oral route, you have the intravenous, you have the intramuscular, you have the subcutaneous. There are different ways to administer medications. So you can imagine you getting a package, and you will see some of these drugs, they will write IM, meaning intramuscular, stroke IV, meaning that you can use either route of administration. But you also have two different fluids in there. There's a particular one you use to mix when you're giving into the muscle. There's another one you use to mix when you're giving into the vein. So this scenario is playing out. The person you're calling is not a doctor, is not a nurse, and is not reading the leaflet. He or she just sees two liquids.
She didn't even read the leaflet to administer such.
So the person just sees two liquids and a powder, and he just thinks it's just any one of them that he can push through the vein. If he goes to push the one that should be for the muscle, pushes it into the vein, that's a problem. And people don't think of that. And what can happen right there in your own home. Then at the end of the day, when you see some strange reactions happen or some strange complex issues coming up, you run to the doctor that you were running away from initially. I don't think it makes sense. No, to be frank, why would you do that to yourself? This is your life here. Your life is on the line here. the decisions you make affect everything about you. Then you now run back to the hospital, gasping, running back to the hospital, can't breathe well, running back to the hospital. And then when you get to the hospital, how would you even say it that it was somebody that gave you something under your own roof? The first question would be, is the person a doctor? Who is this person? And you say, no, it's one person that lives down the street. Everybody uses the person. Everybody goes there. And excuse me, this is your life. You have taken a wrong step. You have made a wrong decision. And at the end of the day, you have given your life, or you have put your life on the line to somebody who is not licensed to do so. So you run a lot of risk. Look, let's not underestimate licensing or a professional doing something. I think we underestimate it. There's a lot of training that goes into it. There's a lot of ethics of the profession that goes into it. You can't find it in somebody who is not trained. Just forget it. It won't happen. But that's the truth, and it has put a lot of people in trouble. But like I said, for me, it's even more painful for children. If an adult would subject himself and he's lying down on his couch and they are using drip, tying it to his ceiling fan to give him drip, that's his business. Because he's an adult and he's old enough to make choices for himself. But that's not what we advise, though. But if you're doing that for your child, I think that's criminal. Because that child didn't choose that.
Doesn't know anything.
Exactly. That child is dependent on your choices and on your decisions. And you make a wrong choice, make a wrong decision on a child's future. I think that's horrible. We need to do better. We need to know a lot of things. We need to be open. We need to have a reorientation. Professionals are there for different reasons. That's why you have the legal profession too. That's why you have accountants. That's why you have different professions, because they've gone into so much training for whatever profession they are in. And that has tailored them to be perfect, to be experts in that field. We should not trivialize that. And we should not sweep it under the carpet, not even for a health condition that determines whether a person lives or dies. I think we need to do better as a people. Yeah.
Voice of the People 90.3 FM. This idea, I was talking about one drug fits all. Sometimes you wouldn't even imagine, how can you, is it possible? I don't know, you are a doctor. Maybe I just cannot. I'm looking at how to really quote this question. You have several, what do we call that now? Several chemicals, beautiful chemicals put together to solve several issues inside one bottle.
Yeah, that happens.
Several compositions here and there, and they say, well, so you means you don't have to go buy drug A, B, C, D, E, F. Just buy drug A. Everything you need is inside. Is it a drug like that, really? Aside this Agbo thing, I don't know.
There's no drug that one size fits all. That it's just for everything and everything. Whether you have headache, you have migraine, whether you have swollen feet, your tummy is paining you, you're stooling, you're having diarrhea. This same drug is nobody. That doesn't.
But how come we see these
right.
drugs in some of these places, motor parks or inside the vehicle?
That is why. That is why our people need to
some
change.
of these guys. Actually, sorry for those who are traveling to. What's it called? To the east. They always highlight around Mowe Bafo. They would sell from the from the park, enter the vehicle will move, they will start preaching, they will talk. Maybe some will even highlight at Jebo Day or the likes, and they will sell these drugs. They tell you it's good for this, it's good for that. Inside the Molue, inside the Los Euros, you will see these people selling all of that. So that's why I asked you, do we really have such composition? A, B, C, D, E, F, G, H inside one bottle.
If we want to be factual, there's no such thing. Because if there was a such thing, trust me, it would be the doctors that will even have something like that. Because the medical field is into a lot of research. The medical field is dynamic. If there was something like that, one final fix-it-all medication, then trust me, all the developed parts of the world will have it already. But the truth is, there is no such thing. So if you have somebody selling anything to you, we should know that anybody selling anything to us, talk is cheap. Anybody can say anything. Anybody can say anything to convince you to put your hand in your wallet and get out money. They can tell you anything. So telling you something is not something that is far-fetched, that is hard to do. Anybody can sweet mouth you and tell you this has done this has. Have you seen the person it has worked for? Have you seen people? And unfortunately, it is. See, I would rather. Maybe I would be able to accommodate this if it's something that has to do with something else, but not your health. Maybe if it's something like, okay, you buy a phone, they tell you this phone is so good, it's so excellent, it has all these features, this, and you get home and you see that it's nonsense that you bought. I would even still tolerate that, because it's not something that is a do or die thing. It's not something that will kill you, but something you will consume into your body that has the effects, a potential effect of harming you, and you are taking that big risk. No verification, no scientific basis. You don't know. You don't, even when they ask, sometimes you can ask the person selling it too, please, what are the components of this thing? No, just face the person and say, can you list 5 components in this thing?
Okay.
And then you now start hearing all sorts of things, people stammering, people giving you excuses and all that. And at the end of the day, you still subject yourself to those things. Even if they tell you that this is what is there, can you verify that that is what is there? Were you there when it was produced? Were you there when it was packaged? Do you know under what conditions it was packaged? Do you have such idea? You don't know. And yet you still go ahead and take that risk. And then you leave the real professionals who can help you out. You shut the door on them. And you listen to somebody who can't help you. And at the end of the day, you run into problems. But do you know one thing?
What?
They don't go back to those people that caused the problem when the real chips are down.
No, now. How would you want them to go back?
I would expect that you should go back there and tell them, do you have a stronger one to work now? Now the problem has escalated. Now that one you gave me is not working again. Do you have something more? You seem to have the answer. But they don't go there. Then now they suddenly remember that you should go and meet the real professionals. And mind you, time is of the essence. They've wasted valuable time. Complications have cropped up already. And they are now hanging in the balance. Now it's now a 50-50. And then you now see people kneeling down and begging the doctor, doctor, please don't let this person die. Doctor, please do everything you can do to save this person's life. Whereas you caused the problem. I think we need to do better. For me, it's really something I really find hard to wrap my head around, that people can still be doing this in this day and age. Subjecting yourself, the health of yourself, your own self and your loved ones to what you cannot verify. To what you don't know about. And NAFDAC is doing their best in trying to see how they can do some regulations on this, but NAFDAC will not live your life for you. NAFDAC will not control your resources for you. NAFDAC will not tell you this is what you should buy and this is not what you cannot buy. It's still your own decision. So we need to work on people's minds and let them see things from a different perspective and learn to do better.
Okay, I want to read this message verbatim, the way this person sent it. All right? He's blaming doctors right now. So let's read it. Let's read it. He said, "Good morning, doctor. My name is Gabriel from Ikorodu. Doctor. And let me just read it. Your physician, or rather, you physician are the reason why people resort to self-medication. Because when they come to you, you seem to place money above everything. In most cases, give people life-threatening bills. Most hospitals have very rude nurses who have no empathy, no compassion, nothing. Nigeria is in a big mess. It's a country where we enthrone money above life. God help us." It's up to you. How would you respond to this?
Well, I would say I would agree with some of the things he has said. And to be honest, we need to do better even as professionals. In as much as we are saying, oh, people should change. Even in the health system, there's a lot of modification. There's a lot of in-house renovation that we're supposed to do, to put it that way.
Okay.
Yeah, because the health system too, has created a situation where I would not completely blame the health workers, but of course they are the ones that the people see. Certain policies, the government involvement too, may also be influencing, how people put their best at work. Because if you're going to work and you're not happy, it will reflect in your service, certainly. So there are a lot of factors to that. For me personally, I think the government is not doing enough in terms of budgeting towards health. If you look at our yearly budget, I don't know. I think the health sector should be ranking one of the highest sectors that will be highly, funded. But it's not so. And secondly, I think a lot of people working in the health sector, their work is hectic, their work is stressful, they are seeing a large number of people, and you expect them to be at their best always. But are they well remunerated too? That's a question you should ask. So for you to give quality service, you must have job satisfaction. That's, I think, that has to do with the government and the owners of private hospitals and all that to decide what they want to do on that. Because if you don't improve the working conditions of your workers, you can't expect them to treat your clients right.
Okay.
So that's that. Then if you say that we put money above life, that is not entirely correct. Because the oath of medicine says that you respect life and you're a lifesaver. So money is secondary. You need to save human life first. But the truth of the matter is, we always look at the doctors as the bad people, but Nigerians still have shown doctors shege. That's the truth. They have. And I've had personal experiences myself. You help people, they rush in somebody as an emergency. I have seen this happen in my own shift. I've seen a patient that would have died if we did not stitch the laceration. The person had a deep laceration in the hand that was affecting a major blood vessel, and the person was bleeding torrentially. And it was so late at night that they kept saying, there's no way we'll get money now. There's no way we will get this amount of money you people are asking for. But just save this person's life in the morning. 8 a.m. in the morning, we'll make sure that your money is paid. You go ahead, you save the life. In the morning, stories come. In the morning, they may not even pick your calls again. And another one is, they will rush in somebody who can barely speak, semi-conscious, who is at the verge of giving up. And then you do everything to save the person's life because you're not looking at anything money or financial. You're just giving all it takes to make sure that you save the person, and the relatives can see how you are sweating and doing your very best to keep this person alive. And the next day, the person is a lot better. The person is now sitting up, the person is talking, the person is conversing with the family members. They are all happy. And when you now tell them, oh, this is your bill, they'll say, you people should carry gun now. Tell us that you're armed robbers now. Even the patient will tell you, what did you do for me? Yes.
Oh, really?
Yeah. Even the patient will say, what did you do for me? What did you people do for me? Has it passed this thing that you people gave me? What else did you people do for me that are giving me this kind of bill? And when you tell them that we gave this, we gave that, we gave this, normally if we would have given you the bill when you came in as an emergency, you would say they are wicked. But now that they've saved you, now you have energy, you have strength, you've collected all the treatment that you're supposed to get, and you are well now. Even the patients will say, no. I don't know what you people did for me. You people, you didn't do anything for me now. What really happened to me, in fact? And they turn it back at you, and you're wondering. So would you blame a health facility that now says, I need to make sure I know how I'm going to get my money? Even at the point of entry, no matter the emergency. Because we've seen different scenarios.
Doc, aside this, let me add this. When it comes to, for instance, people feel when they get to the hospital, they should have some level of soft landing. Forgetting that, okay, fine. If they go filling station to go buy fuel,
you have your money for hand.
Yeah,
if you enter restaurants, you will not order chicken and grilled snail without having money in your pocket. Though you won't tell them that let us eat first. When we are finishing the food, then we'll be talking of how much it is. They would have told you this is how much it is. You can't walk into a supermarket or a store and not check the price tag. That this
Nigerians, it's always like that. When they get to the hospital, they feel no, you're supposed to know now. This is human life. They will not be preaching life to you.
Okay, human life. But those medications were not gotten free. The running cost of the hospital is not free. The hospital power bills are not free. All the machines and all the accessories in the hospital, they are operating based on a bill. Funds needed, like every other organization. But you trivialize that. I don't think that's fair. We need to tell ourselves the truth. That is absolutely not fair. And you expect these people to just take you in, do all the things they're supposed to do for you, and I cannot come into your own shop and pick up anything I want without payment. So I don't know. I don't know where that idea is coming from. The health system or the health sector is just like any other sector. It needs money. It needs funding to be able to operate properly. So if they are giving the drugs free to everybody like that, for the next emergency, is there anything, and we don't have money to replenish our stocks? So what are we going to use to save people next time? People should have a rethink. We shouldn't just jump to conclusions and just blame people. We should be fair in our judgment.
We have to go now. I've got plenty questions coming on and calls alongside. But you know what? You can catch the doctor on Doctor's Mic on Facebook. Just go to Facebook. You want to ask any question, you want to do whatever it is. There are doctors lined up there, plenty. All right, that's what we've been able to do on the show. Capable doctor surgeons, all of them. Nigerian doctors, Yankee doctors, all of them. Let's go to what did I call it again?
Doctor's Mic on Facebook and on Instagram.
Beautiful.
Just leave all your questions or your comments. We'll surely respond to you.
Your inquiries, anything, okay? Doctor's Mic on Facebook.
On Facebook
and Instagram. Doctor's Mic, doctor, right? You know how to spell doctor. DOCTOR. Abi?
Apostrophe
S. Doctor's MIC is the mic. Doctor's Mic, okay? You can follow them and then drop a question, because all of this plenty already here. Make we leave them for that side. Thank you so very much, Doc.
Thank you for having me.
Thank you for coming.
Thank you.
My name is Jude on social media: Instagram, TikTok, Twitter, YouTube, Facebook, everywhere. I am IKAMIJUDEH. IKAMIJUDEH. Ikami Jude. That's it. But my name is Jude. Ikami Jude. I love you all so much. And I will be back here tomorrow by the special grace of God. 7 a.m. is the time. I'm out of here. Good morning, Nigeria.